look in on an actual preceptor with an actual learner.
If you could just refill this, that would be really great.
Okay, Percocets, what are you taking them for?
I've just got this pain off on the side here, and it just kind of goes down and all the way up. So if I could just get that refilled, that would be really, really helpful.
Okay. How long have you been taking them?
Well, the last year or so, it's just, it's kind of persistent pain.
Right.
Down in here. I'm on the last one, so if I could just get that refilled, because I really need to go do my errands and stuff like that and get some stuff done. So while I'm doing that, it would be great if you could just write a prescription for more.
And how many are you taking?
I don't know, just a couple, just to get, ease the really bad pain.
And is it working for you?
Yeah, no, it'll do. It'll be fine. I just really, really need some more.
Okay, Scott, that's good. We got lots to talk about there. First, in terms of your appearance, you are a professional. You want to look like a professional. That means tie to your hair, do up your top button. You're a physician, you're not Magnum PI. You want to roll down those sleeves. You want to look the part, right?
Okay.
And then second is demeanor. Okay, so you want to be prepared. You want to have all your questions laid out ahead of time. Having looked at her chart, you're going to know what her pharmanet looks like, who her regular GP is. You're going to know what questions to ask. You want to maintain eye contact. You're not going to focus on her chest. You're going to focus on why she's there and asking more questions around the pain and what's causing it, so that you're going to know if your treatment is appropriate to the condition, not just generalized body aches, because that's just a bottomless pit of narcotics, right? So next time, just focus a little bit more on the problem at hand and just take a really professional approach to it.
Okay.
Wow, that was a lot of information. I wonder what Leslie has to say.
This is an interesting scenario, and it demonstrates a common pitfall. That's giving too much information in one feedback scenario. In this particular instance, the preceptor does a very good job about labeling specific problem behaviors, but goes on and on and on about all the behaviors that the learner needs to change. That can be very overwhelming to a learner and quite deflating to the learner. So I encourage preceptors to think strategically about the feedback they give to learners. Reflect on what behavior could this learner change that would really make a big difference in their performance, and then limit your feedback to discuss that one or maybe at most two behaviors.
Okay, for an effective feedback session, a preceptor should discuss one or two behaviors that make sense. Leslie, do you have any thoughts about how the preceptor approached the learner's appearance and style of practice?
I recognize that we all have different ways of doing things. One preceptor might like to wear a white coat, another preceptor likes to have rolled up sleeves. One preceptor likes to introduce himself as Dr. Smith, the other preceptor might go by a first name basis. The important thing is when we choose to tell a learner that we think they need to do something this way, my way, we should at least be explicit about why we think this way is the best way. So the reason that I choose to wear a white coat or use the name Dr. Smith is because I think my patients perceive me as more credible and more professional when I adopt those behaviors.
Great point, Dr. Sadownik.